Everybody is enjoying
Oh,
the
that's
rainy
good.
day.
I tell you,
How are you
this.
doing, Dr. Nikam?
I am doing very good. Thank you. How are you? Who is this?
Doing well. How are you doing, Sudhir bhai?
Oh, I'm fine, thank you. Yeah, good to see you all.
Good seeing you, yeah.
Good morning, Sudeep and Nick. Good morning.
Good morning, good morning.
Maybe if I just close this, then I can focus on here. So I can see at the top. So we are recording this, so hopefully we'll have it processed and put it on the website. We'll wait for, it's only 10:59 now, so we'll wait for a couple of minutes, and once we get more people coming. Sudhir?
Yes, I'm here.
Okay, you can get started, and then we'll proceed. And they will, as people join, I'll just let them in.
Sure.
So, yeah.
Well, thank you everyone for joining on this rainy morning. I guess everybody is cozy at home or wherever you are. I would like to say that I'm very proud to invite Dr. NIK NIKAM to join Health Life 360, and he will also be with me, in conducting this Zoom meeting. He will have his perspective, and I will jump in wherever needed. So, with that, I would like to invite Doctor. He has been a great community leader and a well-known figure in Houston area. So, Doctor, with that, if you may please start the meeting.
Okay, thank you, Sudhir. Good morning, ladies and gentlemen. And as Sudhir said, I am Dr. NIK NIKAM, a cardiologist. I have been in the Houston area for more than 40 years, dealing with Medicare patients from a different perspective as a consumer. And today we are going to be talking about their Medicare insurance, which is a very complex subject. We'll try to see if we can simplify this. So there's each and every one of you who are approaching the Medicare. Okay, so welcome to the Medicare Seminar, and I'm Dr. NIK NIKAM, and Sudhir Mathur introduced. And here's our contact information, and we are going to videotape this and put it on the website. Today we are going to be talking about Health Life 360 with particular reference to Medicare, Medicare Advantage plans, prescription plans, and Health Life 60 has been around for more than 25 years. Sudhir MATHURIA is quite experienced in this field. He deals with the senior healthcare and individual health plans. In addition to just dealing with Medicare and Medicare Advantage plans, Health Life 60 also provides life insurance for all age groups, including child gifting, long-term care, which is a totally different insurance compared to all the other insurances that we are going to be talking today, and also deals with annuities for your long-term safe investments, along with group health, including dental, vision, and travel, etc. We also talk about life insurance, not in this presentation. Health Life 60 deals with estate planning in terms of using life insurance as a means. Okay, the agenda for today is we're going to be talking about Medicare basics, and it is particularly important for those people who are approaching their Medicare age and don't know where to start or where to go or how to get help. So we're going to be talking about that. And for those who are already in the Medicare program for a couple of years or more, we are going to be talking about Medicare Changes for 2022. Then I'm going to talk something about Medicare Supplemental Plan, which goes with the traditional Medicare. And then we're going to be talking about the Medicare prescription drug plans, and then we'll open up for question and answers. If you have any questions while we are doing the presentation, please do stop us and we'll be happy to answer your question before we proceed. And we would like to sort of quickly give you an overview of what Medicare is. Medicare is more complex than getting an insurance from an employer when you're working for somebody. Basically, you just go sign a piece of paper, you get your insurance cards, and that is done, and hopefully you never use it, and you just go on with your regular work. But when it comes to Medicare, this is something which each and every one of us have to take charge of and stay abreast of what's happening on a yearly basis so that we are becoming a sort of an educated consumer of healthcare or Medicare services. Okay, with that, let's begin with the Medicare. Medicare is, of course, government insurance provided by the Social Security Office, and this is something we get when we turn age 65. On the first day of our birth month, the Medicare becomes effective. In order to be eligible for Medicare, we have to have at least 40 quarters of payroll tax deductions, and we should be eligible for Medicare Part A. Whereas Medicare Part B is the mostly called the physician's part or the outpatient services and outpatient equipment, things like that. That is something which we have to buy from Medicare paying a premium. And we'll expand on that in a minute. That just doesn't cover everything that you need in the Medicare age group to meet all your health care requirements. So here is a little nice layout of a comparison between traditional Medicare plan and a Medicare Advantage plan, which we are going to be introducing to those who are new to Medicare insurance itself. As most of you who already have your traditional Medicare or the free standalone Medicare insurance, as you know, you have Part A, which covers the hospital services and some hospice care. And we have Part B, which covers the doctor's office visits, outpatient services, outpatient tests, some equipments. And Part D is a prescription plan, which is separate from Part A and Part B. And even with all this, you're still not completely covered as far as traditional Medicare is concerned. You have to have a supplemental insurance, which is known as the Medigap. So going from signing a piece of paper at a work and having an insurance card, now when we enter the Medicare age, remember we have to have all these four. At least we have to have three minimum parts in order to get basic Medicare coverage. I'm talking about basic Medicare coverage. The Medicare Part A is something automatically given by the Social Security Office. You don't need to apply for it. However, when you approach your Medicare age, you have a 7-month period during which you are eligible to apply for Medicare Part B. And once you get your Part B approved, the Social Security Office is going to deduct your premiums from your Social Security check. Part D prescription plan is an important aspect of the traditional Medicare. It is something we have to buy from an outside agency, something like Health Life 360, where we can find out what is the most appropriate prescription drug plan if you are in the traditional Medicare program. So there is a premium for this one, and still all these three still don't cover all the expenses that you may incur during the Medicare time. That means you have a hospital deductible, your Part B copays, and also prescription copays, and all of these things have to be addressed, which is going to be done by the Medigap Plan or what is called the Medicare Supplemental Plan. We're going to expand on that in a minute. So this is the the traditional Medicare A, B, D, and supplemental plan. That means going from signing a piece of paper, now we need 4 different kinds of insurances to have even basic medical coverage. That still doesn't cover the long-term care. It does not cover like home health services and dental, vision, hearing. So there are many things that all these 4 parts still doesn't cover. Now, coming to the other side of the equation, the Medicare Advantage plan is trying to, one, consolidate all these services under one roof, under one insurance plan, and also add in certain features like vision, dental, and hearing aid services, and it also includes the prescription plan. So that's the advantage of this, and this is the Medicare Advantage plan. We're going to be fully talking about Medicare Advantage plan in depth during the next several minutes. So here we have no premium for Part A, we have a premium for Part B, premium for Part D, premium for Part Medicare or Medigap plan. Here, if you are on a traditional like an HMO Medicare Advantage plan, you probably have 0 premium except for some copays, and which we'll talk about. And of course, the prescription plan in most Medicare plan Advantage plans are included in the package. With that, we're going to move on to the second part of our agenda. That is, we are going to look at Medicare changes for year 2022. So let us look at some of the changes. For those who have already been on Medicare for several years, it is important to listen to seminars like this and get an update of what is happening in the coming year. Medicare constantly updates its guidelines and its requirements and also premiums. So that's an important aspect that each one of us should follow up and maybe talk to your agent who wrote your policy to start with, so that you are abreast of the new changes. And if you have to change any policies because of varieties of reasons, which I'm going to touch upon during the latter part of this presentation. Okay, the first thing is, I told you Medicare Part B, there is a premium. The premium for Part B for 2022 is $158 per month, and this is going to be taken out of your Social Security check. The Part B premium has gone up by about 6.74% compared to year 2021, and generally speaking, the premiums keep changing every year, and that's something we need to keep track of so that we can budget our resources accordingly for the coming year. Next, Part B premium, in addition to going up to $158.50, we also have a Part B deductible. That is, the first $203 is something which we have to pay out of our pocket. And that is going to go up to $217 in year 2022. Similarly, if somebody has to go to the hospital, you have an annual deductible. I said annual deductible because it resets every year of $1,484. We don't have the new number for year 2022. If there is, Sudhir is going to highlight on that one. Next, if you are still working at your Medicare age, and if you are getting income, earned income, then you pay an extra premium for your Medicare Part B supplement, Part B insurance. That means if you are a married person earning between $218,000 to $272,000 income, your premium goes, this is from 2020, but anyway, just comparison, let's look at it, from 144 to 289. It's almost doubles. And if you are making over $500,000, it may go to $462 and change. So keep this in mind, and if you see your Social Security check shrinking, and this is one of the reasons why your Social Security check is far less than what the gross amount is supposed to be. And this is going to continue as long as we report an earned income during the Medicare ages. Next, the Social Security comes up with a excuse me, the Social Security comes up with a cost of living adjustment, and surprisingly, in year 2022, the cost of living adjustment is going to be 5.9%, which by Social Security standards is an astronomical increase in Social Security benefits for year 2022. This has been the highest increase in the past 40 years. So if you are getting Social Security checks, you'll be pleasantly surprised that you'll be getting 5.9% increase in year 2022. But along with that, there's also increase in premiums for everything that relates to Medicare services that we get. The Social Security cost of this nature was seen only in the year 1980s during the Jimmy Carter years, when the interest rates were like 12-14% and the inflation was like more than 12%. So this is a substantial increase in the Social Security change for year 2022. Next, the Medicare Advantage plans have also included telehealth services, which started in year 2020 and 21 due to the COVID crisis, and they are going to be expanding this to many different specialties, and they are already covering a number of specialties like dermatology, psychiatry, cardiology, endocrinology, and many other specialties, and they're going to be increasing more and more of this, so that if you are just needing a prescription filled, or if you are just trying to go through some lab tests, that is something that can be done on a Zoom meeting, something like what we are doing today, so that you don't have to drive across town in a rainy weather like today to get your questions answered. Next, starting in 2021, the Medicare Advantage plans can also take care of kidney patients or the end-stage renal disease patients who require dialysis. This used to be mainly handled by Medicare and Medicaid insurance, but now the Medicare Advantage plans can also bring all your services plus prescription plans and coordinate with a special team of healthcare workers, so that you are not just dealing with multiple insurances like Medicare, Medicaid, prescription plan, and different doctors and nurses. Here you have a team which is called the Special Needs Program, where you can talk to your coordinator and get all this coordinated through one resource. That's one of the advantages of having this Medicare Advantage plan for renal patients who need dialysis. Next, we're going to talk a little bit about the Medicare plans. Medicare Advantage premiums are going down by $21. I was surprised when Sudhir showed me this slide, and he's going to expand on that a little later as why the cost of Medicare Advantage plan premiums are going down while all the other premiums are going up year by year. Next, we're going to talk about Medicare Supplemental Plan and how it compares to Medicare Advantage Plan. In the initial part, I told you about the traditional Medicare, which has Part A, Part B, then you have the prescription plan D, and the supplemental plan, which is to cover all the co-pays and deductibles. So let's look at some of these Medicare Advantage plans. They are like letters A, B, C, D, F, G, K, L, M, N. Are there any more, Sudhir, or is it just a partial list?
I think it's a handful to deal
Absolutely.
with.
Okay, so let me just highlight on two particular plans because they cover most of the services that we are looking for in terms of Part B deductible, in terms of Part B copay, in terms of Part A deductible, and those are the plans F and G. The only difference between F and G is that Part G does not cover the Part B deductible, which was $217, which I showed you for year 2022. Apart from that, these two plans are identical, and because it doesn't cover $217 deductible, the premium on plan G is going to be slightly less compared to the Plan F. Plan F is a unique plan because most people who are starting now won't be able to sign on to Plan F. If you have any questions about that, we can answer that later. Whereas Plan F has certain additional features like some benefits if you travel outside the United States. That's one advantage for foreign travel, and even G gives that also. And it's going to be very nominal. They're not going to cover a heart surgery or a hip surgery, but they're going to cover a part of the cost of the healthcare services that you get outside the United States. And a little bit comparison between Medigap, which is the supplemental plan which I just showed you, and a Medicare Advantage plan, which in the first slide I showed you, which covers Part A, B, D, and also some additional services. The Medigap plan, basically it covers your Part A and Part B deductibles and copays. It does not need any referral, and it does not cover vision and routine hearings, and it can be like if you have a supplemental plan, it is good anywhere in the United States. Whereas Medicare Advantage plan has a lower premium, but it also has copays, and you have some network restrictions and also some extra benefits which we are going to highlight in the next few slides. So that brings us to the topic of Medicare Advantage plans. I talked about Medicare Basics, Medicare Traditional Medicare. We talked about the changes. We talked about the comparison. Now let's talk about Medicare Advantage plans. Medicare Advantage plans are basically an answer to the traditional Medicare by private insurance companies. And this was done to sort of consolidate all these different things that people had to deal with. And that is something you had to deal on your own, and you had to find an agent and you had to talk to them and see what works best for you based on your drugs, based on your doctors you are seeing, based upon the hospitals that you are using, based upon whether you are in a single location or you travel 6 months here and 6 months there, in and out of state. All of these things need to be taken into consideration before you select a Medicare Advantage plan. So let's look at some of the features of the Medicare Advantage plan. Just like in the private health industry, where we have all these Aetna, Humana, Cigna, Kelsey, Oscar, and United Healthcare, they all provide these Medicare Advantage plans, and they are rated as 1 to 5 stars, and we don't have the ratings for 2022 for all of these, so that's why we haven't put it. But as I mentioned, they have two major categories of plans, namely HMO and PPO. It is similar to the HMO and PPO we have in the private healthcare industry, where we get a insurance through our employer. So let us look at what are some of the major differences between an HMO and a PPO. And here's a slide. It's kind of busy slide, but we're just going to give you highlights. This is just like the tip of the iceberg. I mean, there are so many different variables that have to be taken into consideration before you select a given plan, and that can only be done by experts like SUDHIR, MATHURIA, and other people in the office. Okay, first of all, Medicare HMO, just like your traditional Medicare HMO, has no premium. It has a gatekeeper, and you need referrals, you need authorizations, and yes, it has prescription plans. There's a $3,000 plus out-of-pocket cost, and if you go out of network, the cost can almost double. And HMO, you have to see, in most cases, unless it's an emergency, doctors in a network and hospitals in a network. Whereas PPO has a little more flexibility. It has a very, very nominal premium, and you don't have to deal with a gatekeeper. You don't need referrals to see a PPO doctor. Of course, you're going to need authorization if you need a knee surgery or if you need a CT, MRI. You're going to need authorizations. It doesn't matter what plan you have. Of course, it includes a prescription plan, or you can have a separate insurance prescription plan. The cost is going to be almost like $7,000 plus, and out of pocket could be like more than $10,000. But you have the benefit of seeing doctors and hospitals out of network. And again, all of these things have to be sort of pre-verified, so you are not stuck with a surprise bill at the end of the hospitalization or at the end of the procedures. Okay, we're going to talk now a little bit about how do we enroll into a Medicare Advantage plan, and if we think that is the best approach for your particular case. So in order to enroll into a Medicare Advantage plan, there are certain specific periods during which we can enter into a Medicare Advantage plan. We have the annual election period, which is the most important period, which is of course going on right now between October 15th all the way to December 7th. Then we have the special election period we'll talk about. Then we have the Medicare open enrollment period, which kind of ties into the Medicare Advantage plan, and I will explain in a few minutes what that is. Okay, starting with Medicare Advantage plan enrollment. This is the most important thing that you want to remember if you want to, one, get into a Medicare Advantage plan, or if you want to switch from your Medicare, traditional Medicare to a Medicare Advantage plan. This is the time between October 15th and December 7th when you can talk to one of the agents at the Health Life 360 and discuss all your requirements. You know, what medications you're on, what doctors you use, what hospitals do you use, and do you travel? And all these things need to be taken into consideration and see which plan fits best for you, an HMO or a PPO or a fee for service. So there are various kinds of plans, and they all have different benefits, pros and cons. This is an annual. What can we do during this period between October 15th to December 7th? We can change from original Medicare to a Medicare Advantage plan. We can return to original Medicare from a Medicare Advantage plan, or we can switch from one Medicare Advantage plan to another one, and we can add a Part D prescription plan or switch prescription plans. Any changes that we do between October 15th to December 7th will take effect on January 1st of the following year, which in this case will be 2022. Okay, the Medicare enrollment is between January 1st and March 1st. This is primarily for Medicare enrollment, but during this period, we can also do certain things if we are in a Medicare Advantage plan. And that is, if you are in a Medicare Advantage plan during this enrollment period, the Medicare enrollment period, January 1st to March 31st, if you are in a current Medicare Advantage plan, you can switch over to a new Medicare Advantage plan. Or you can go from a current Medicare Advantage plan to original Medicare plan, which was the one which I talked about at the beginning of this presentation. And there are some restrictions which we will cover later on. So during this open enrollment period, to summarize, we can switch from Medicare Advantage plan to a different one. We can return to original Medicare from a Medicare Advantage plan, or we can get a standalone prescription. So those are some of the things that we will be able to do during the January 1st and March 31st period. Okay, we are going to look at some Medicare Advantage plans that are currently available in our local area, and SUDHIR is going to highlight on some of these plans. After that, we are going to move on to the prescription plans. Then we will open up for question and answers. SUDHIR, you can start from here.
Yes, thank you, Doctor. And I'm going to highlight some of the plans in Houston area, and later I will mention about Dallas area. So Oscar is a probably third year or fourth year coming to Houston area. And the unique feature, it is a HMO plan. However, the unique feature is that in this particular plan within the network, there is no referral required. No referral required. They have two different plans, one with a zero premium and much higher dental benefit. However, the other plan, which is called Oscar Easy Care Plan, has a $1,000 kind of a Visa card given to the member, and that Visa card can be used towards any kind of co-payment or co-insurance for medical treatment only. So it is by getting that $1,000 card, for a normal kind of health condition, I would say that there will be zero out of pocket because most of the expenses will be covered by this flex card or a Visa card. So this Oscar is a HMO plan without referral, and also if you choose the plan Easy Care, it has that $1,000 benefit. Next one, please. Devoted, as you all know, that almost all Medicare members or Medicare beneficiaries are receiving mail from Devoted. And Devoted has become popular, and this is going to be the fourth year entering 2022. This Devoted plan has two different plans. One is a core plan, the other one is a prime plan. Core plan is a zero premium. Prime plan has a $25.10 premium, rich benefits, and dental is unheard of, which is $3,000 dental benefit for a core plan and $5,000 dental benefit for a prime plan. This plan uses Methodist Hospital as a main hospital, and also Methodist doctors are mostly in the network. Also is available in all surrounding counties of Harris County. So Devoted has earned some popularity, and it has grown as long as your doctors are available and your medicines are covered, which most of them they do. So next one, please. Humana is a kind of a standard national company with a zero premium Humana Gold Plus HMO with hardly any changes, and also has a $10 monthly premium for a PPO. They do have other plans with a much higher premium, but the most benefits are derived from these two plans. It has a good amount of dental benefit, but honestly, it is hard to utilize that much amount because of the fact that there are some restrictions. So, overall, good network. All the three hospitals are included, three meaning the Methodist, St. Luke, Memorial Hermann are included, and some of the HCA hospitals such as West Houston, etc. In Dallas area also it is a popular plan, and it is a similar plan. Next one, please. WellCare, the one before.
Oh, okay. Sorry.
The WellCare, there are 13 different plans in Houston area, and their dividend plan, which is HMO plan, still gives that money back towards Part B premium, and the amount is $95 here. In Dallas area, it's $100. It is a good plan for someone relatively healthy. Otherwise, I would say that this plan has a higher copayment simply for the fact that they are giving the rebate back. It does have some dental, vision, gym, etc. Now, like I said, there are 13 different plans, but this particular plan, because of money back, is has been a little popular plan. Um, Network is a challenge sometimes with WellCare. Um, However, if your doctors are there, it can work. Um, Next one, please. AARP United Healthcare. We all hear AARP name since we turned 50. So they are bombarding us since 50. The name is very popular, and United Healthcare is using AARP name by paying a royalty. Insurance is provided by United Healthcare. It has a United Healthcare plan has a pretty good network, insulin friendly. It has a new plan both in Houston and Dallas area called HMO POS LI plan with a lower copayments. However, I want to mention that this particular LI plan uses well-made network only. So all the doctors may not be there unless you choose a well-made doctor. Well-made is a sort of a clinical network owned by United Healthcare, and there are doctors who are employed, and there are doctors who have joined the networks. So it is a well-made network only. Um, so United Healthcare does have a HMO as well as PPO, and depending on your need, one can choose that. Next one, please. Now, Kelsey, we have all heard in Houston area about the Kelsey plan. This particular plan, Gold Freedom HMO POS, has a zero premium. The unique feature with this plan, it used to be a $77 monthly premium for Kelsey in 2021. In 2022, it is reduced to zero. The primary care doctor is zero in network, and you can go out of network, keeping your current doctor with a $10 copayment, and a specialist doctor $25 within Kelsey and $35 out of Kelsey. There is a dental benefit of $1,500. In-network hospitalization is $375 per stay, and one can use out-of-network hospitals also, such as MD Anderson. Now, in-network hospitals are St. Luke and Memorial Hermann. However, Methodist and MD Anderson are out of network. It does include prescription drug and also a gym benefit, and it is like a PPO plan, though it says HMO POS. POS stands for point of service, and that allows you to go out of network. So you are getting pretty much HMO benefit, a PPO benefit with HMO copayments. Um, and it is a 5-star plan, so it has earned some reputation. Next, please. Aetna has been a national company, of course, and we have heard of it has
Excuse me.
3 HMOs and 2 PPOs in Greater Houston, and similarly, there is a similar plans in Dallas area. However, there is a one new plan introduced, which is a select plan, and select plan HMO has rather relatively better benefits, but the network is different, so one has to know the network. It covers all the 3 hospitals, and also under PPO, one can use out-of-area network. So Aetna has been a well-known company for a long time, and provides a good choice.
Excuse me.
Sure. Next one, please. This Scott and White in Dallas and Waco area, it is affiliated with Baylor Hospital, just in case if somebody from Dallas has joined, and it takes care of Baylor Hospital and all under one roof. Next one, please. Care and Care is a HMO and PPO plan out of Fort Worth, and it has one unique PPO plan with a $200 monthly premium. It works very similar to a supplemental plan with most of the cost sharing zero. So it's a great plan for someone trying to switch back in Dallas area. Next one, please. So as I said, we represent all the major companies in Texas and out of Texas, and we service and offer evaluation. We can analyze the plan. It could be a supplemental plan, or it could be Medicare Advantage plan. We look at your needs, your doctors, your other needs, your prescription drug plan, and come up with a suggestion so that you are making a informed decision. So next one, please. And definitely we can help you. It's worthwhile because one can do things on internet, but there are things that are not so much known on internet. Like doctor says, Dr. Google is not everything. You will miss out some things that may be very important to you. And we can help you. Yes, give us a call. Next one.
So we are going to move on to the next part, which is a prescription part, which is a very important one. And after that, we're going to question and answers. Somebody asked a question about what is the cost of prescription drug plan, and that brings us to this topic of prescription plan. Prescription plan, all across the Texas, the cost of drug premiums are pretty much standardized because if you look at each state has a different color. Based on the color, the premium is going to be sort of very similar with various plans.
Yeah,
More
it is
important,
checked to be precise.
Yeah.
All the plans are identical in
I see,
state
yeah.
of Texas, which is a region, I believe it's 22. So these
22,
are
yeah.
divided into color-wise, chart region, and each color states with the same color has the same identical prescription drug plan.
I see. Okay, that's good. Okay, when we are talking about prescription drug plan, if you are in a Medicare Advantage plan, for the most part, the prescription drug plans are included in the Medicare Advantage plan. But there are certain circumstances where you may need a separate prescription drug plan. For example, if you are having a traditional Medicare with Medicare supplemental insurance, you are going to need a standalone prescription drug plan, and that has a premium. If you are in a Medicare Advantage plan known as the fee for service, which is sort of a unique one, and there you need a standalone prescription plan. But for most of the Medicare Advantage HMO and PPO, the cost of the premium is included in the program, so you're not paying an extra premium for that. On the other hand, there are costs involved with your prescription drugs. This is an important thing we want to learn something about. Most of you have heard about the so-called donut hole, and see if you can cover that donut hole in this slide. Number one, when you start off the first of the year, you have a $480 deductible which you have to meet before the insurance company pays for your prescriptions. Then your initial coverage is up to $4,430. And here you may have some copay depending upon the various tiers or the levels of the prescription drugs. And I'm going to touch upon that in the next slide. And also remember, when we are talking about $4,430, it is not what you pay as a copayment to the drug pharmacy when you get your prescriptions, but it is the retail price that is printed on your slip that is calculated by the drug programs as to what is the total cost of medications that you are utilizing. So that's an important, so whenever you get a list, you can go to the website and see what your cost of medicine is, because the cost of medicine could be like, could be $100 and you may be paying only $20. But when they calculate this total cost, they're looking at the retail price the pharmacy or the drug program is paying. Then between 4,430 to 7,050, we have the so-called gap, where the insurance company, the prescription program will pay only percentage of the cost of a drug. So if you are getting a drug which costs like $400 and you are paying only like $40 for the copay, and once you go past this level, then that cost may go up to 25%. So your cost may go from $40 to $100, and all of a sudden you'll be surprised what the hell happened. And that is something that we have to keep in mind, and that is based on the retail cost of the drugs that you are getting. And beyond $7,050, you get a catastrophic coverage where the cost of the drug will be a small percentage of the total cost of the drug. So these are some of the things that we need to keep in mind as far as the prescription drug plan is concerned. As I told you, the prescription drug plan in Medicare and Medicare Advantage plans, most of them it is included, unless you have a fee-for-service plan where you need to get a separate prescription drug plan. Whereas if you're on a traditional Medicare path and you have a supplemental insurance, then you need to have Medicare prescription plan. And here's the trick. If you have Medicare Part B and if you don't enroll in a Medicare prescription plan, then every month you are not enrolled in the prescription plan, you have to pay a penalty when you do decide to get on the Medicare prescription plan. Let's say, for example, age 65, you join Medicare, you get Medicare Part B. You say, I'm healthy, I'm not taking any medication, so I don't need a prescription plan. 5 years go by. Now, all of a sudden, you need a blood thinner, which costs $400 a month. Then you say, I better get into the prescription plan. And when you talk to SUDHIR about prescription plan, and you will find out, to your surprise, that you have to pay penalty for the last 5 years that you were not enrolled in the prescription plan. And that's going to be substantially increasing your prescription premium. It is calculated based on what the national average of the prescription plan per month, which is approximately like $33 per month, so that you get 1% of that for each month that you missed. So that's a whole lot to digest. But just remember, if you don't have a prescription plan, you're going to pay a significant penalty, and the penalty is for the lifetime. It's kind of pretty sad, but that's what the reality is. Next, insulin coverage. And this is a very important part because the insulin costs were skyrocketing until 2021, when President Trump introduced a moratorium on insulin costs. As a result, the insulin costs have been standardized. I'm going to show you in the next slide what the cost is going to be. As a result, patients with diabetes can get their insulin at a very reasonable price. And similarly, the same thing is passed on to people who are on Medicare Advantage plans, whether it be Medicare Advantage with prescription plan or a standalone Medicare with a prescription plan separate. And here is a chart which shows before the introduction of that moratorium, the insulin costs were like $600 or $75 or even more, but now it is averaged to like $229 per year. So that your cost is 1/3 of what it would have costed in year 2020 20 or 21. So all these numbers are sort of standardized, and this is a huge savings for patients with diabetes as far as insulin is concerned. And as we mentioned, this cap applies to many Medicare Advantage plans, both HMO and PPO plans. And that's an important thing we want to look into, especially if you're receiving insulin for your diabetes treatment. Now, when we are talking about prescription plans, prescription plan programs, there are certain things that we need to keep in mind. And that's why I keep telling there are so many different moving parts with a Medicare insurance. It is more complex than getting an employment insurance. So when you're talking about pharmacy and prescriptions, we have to first look at what kind of pharmacies do these plans use, what kind of quantity limitations they have. Do they have any restrictions as far as brand new brand name drugs? And very often when I used to prescribe, they say, oh, we can't prescribe this drug because you have to try a cheaper generic version, and if that doesn't work, then we can go on to get you the more expensive drug, and that's called the step therapy. Again, quantity is important. Does your company have a restriction for 30 days or 90 days? And these are all things you need to take into consideration, whether you have to mail in or can you just pick it up from your local pharmacy. So paying attention to all these things will streamline your life, because just going outside to collect these medications can be a half a day's work. And I was talking about like co-pays. When we are talking about co-pays, that depends upon your prescription plan, and it also depends upon the types of drugs that you're getting. And just to give you an example, this is just a sample chart. Don't look at the real numbers, but just comparisons. Most of them may have like tier 1, which are generic drugs. The copays could be 0. And tier 2, which are also generic drugs, the copays could be 0. So this is something you can pull up on the website of your particular drug program and look at this chart in reference to your particular policy. And if you're tier 3, it could be $45 or it could be something different. And as the numbers go up, the costs go up. And when you're in tier 5 specialty drugs like chemotherapy or drugs that are like blood thinners, which are very expensive, then they may only cover them with a percentage of the cost of those drugs. And here you want to elaborate on this one, Sudhir? There's a silver script.
Oh, sure. So we always are amazed by, which will be the most cost-effective or cheapest plan in a prescription drug plan. So this year, 2021, for example, the silver script offered by Aetna has been the lowest cost. However, one has to be very careful because the drug companies or the insurance plans, they do have right to move a tier 1 medicine to a tier 2 medicine list, or it can also be tier 1 can be in tier 3. It is up to their decision. So my point is that, like Doctor said, the formulary is the key ingredient. Like one must check where your particular medicine is listed, whether tier 1 or tier 2 or tier 3. So the lowest cost plan, silver script plan, has remained lowest cost for 2022. One important thing, again, that after tier 1, there is a $480 deductible in that plan. So by mistake or all of a sudden doctor prescribes tier 2 or tier 3 medicine, then you will end up paying a lot more towards the deductible, and then finally can pay the regular copayment after meeting the whole deductible. So your medicines and formulary will play a pretty good role there. The second important plan, and again, we are just touch basing, the important couple of plans, and that is a WellCare Value Script plan, which they have they have reduced the premium by a couple of dollars, and the new premium is going to be $12.90. Tier 1 and Tier 2 are exempt from $480 deductible, and it is a insulin friendly, meaning the insulin listed insulin will be covered at $35 and no coverage gap or no deductible applicable. So this plan is, I would say, is very helpful, because one doesn't want to take a chance whether your medicine is in Tier 1 or Tier 2, and all of a sudden there is a surprise. The WellCare, another WellCare plan, which is meant for people with a low income subsidy, LIS, or extra help, and because the premium and the deductible are paid under this plan by the government, that's why it is a important plan, because if one has that LIS or Medicaid status, then this plan will work. So in nutshell, there are a number of plans. However, we have to check your medicines and also make sure the drug cost is very reasonable and very competitive, and that we can find out by checking your list of medicines, and we can help you there and suggest a most suitable plan. Next one, please. And this is the number, number meaning the income and asset level that will qualify for extra help. Some of you may not qualify, some of you may try, and it is a very simple application by Social Security office. One can do it online, and the decision is made within like about 4 to 5 weeks, and you receive a letter whether you are approved or not. And if you are approved, the cost of medicine, $1,000 medicine can be as little as $10 or $15 or $20. So it is a great benefit if you qualify. Next one.
Oh, okay. There's quite a few people joining now.
Right. So this one, these are all insurance cap, but these are something that we took it down, based on this year. However, the same companies are insulin friendly for next year as well. So, and we can sort it out for you if you need it.
And this is a slide showing some discount pharmacies. Sometimes it may be beneficial to look at all different options, especially when you're in that $480 deductible period, where you may get some of these drugs, but most of them generally cover generic drugs. If you are looking at prescription drugs like blood thinners or something else, obviously they're not going to be, and they're going to be the same cost. In fact, one of my friend called me and they said his wife needed a blood thinner and the retail cost was like $600, and I tried it on GoodRx or somebody else, and it was like $500. So there's not a big difference. So they are good for generic drugs, and that is something you can probably look at in terms of doing some cost savings.
Right. So, and when you use GoodRx, the calculation will not go on record.
Yeah.
So you will not know whether you are approaching, the thresholds. Right.
Yeah. See, that's another thing. And in fact, the previous presentation we made, somebody said we can get drugs from Canada for much cheaper price. And the same thing applies. When these drugs are not recorded on the prescription plan program that you are filling these drugs appropriately, then it assumes that you're not taking these drugs. Number two, it may also bring up the question of non-compliance, because if you are on 6 drugs and you're not filled that prescription for 3 months, then the insurance company may begin to wonder, are you a compliant candidate, and that can have some consequences. Okay, so in the interest of time, what we're going to do is, it's almost 12 o'clock. Ladies and gentlemen, this has been a very quick overview of Medicare and Medicare Advantage plans brought to you by Health Life 360, SUDHIR MATHURIA and myself. And here is our contact information. There were so many questions about whether they can get this presentation after we are finished, and certainly we are recording this presentation. We're going to process it and put it on YouTube and also on Health Life 360 website. And SUDHIR MATHURIA will definitely send a link to all of you about this presentation, and please do feel free to pass them on to your friends who are in the Medicare age group. At least they get some knowledge about how to deal with this Medicare issue. It is much more complex than just employment insurance, and there are so many things that we have to take into consideration before we select the right plan. Medicare, traditional Medicare may be the best choice for you, or a Medicare Advantage may be best for you based upon your resources, financial resources, and various drugs and other things we talked about. That is something only expert like SUDHIR or other agents in the office can look at it. So what we would suggest is you can call this number and set up an appointment to talk to SUDHIR or one of the other agents, and we'll be happy to go over all and answer all your questions. With that, what we'll do is we will open up for a few questions, and thank you so much for joining this presentation. We had more than 45 people, and we are delighted. So we can reach more and more people in terms of educating ourselves about the complexities of Medicare, traditional Medicare, Medicare Advantage plan, and especially prescription drug plans. So if you all have any questions, please do unmute yourself and go ahead and ask. It's easier for me to answer that way than to look at the question chat box.
May I?
Hello, go ahead, please.
Okay. My name is Haraprasad Shastri. You were talking about insulin. Do they distinguish between Humalog and Novolog in this price you were mentioning?
Well, essentially, each company has a formulary, and if it is listed as Humalog, it will be covered, or as any other brand, it will be covered. So it boils down to whether that particular brand is listed in the formulary or not.
So the best thing would be to, like, whenever we choose a prescription drug plan, the first thing I would do is go to their website or talk to us. We'll put all the drugs that you're taking and see if those drugs are covered in that particular program.
I will do that.
Yeah, in that way, it's very simple. If you're already having an existing policy, you can look at that. And if you have any questions, again, we can definitely go over other plans and see if they will cover and if the costs are reasonable and whether it is appropriate to look at something that meets your requirements.
Sure. Thank you.
Mr. Shastri, it's good. My pleasure to see you and talk with you. It has been a while.
Yes, sir.
Yes.
Thank you so much.
Please send me the email because the phone number that I have, somehow it was not connecting. So please do me a favor.
I'll do that. No
Okay,
problem.
thank you.
Thank you.
Thank you, Mr. Shastri. Okay, do we have any other questions?
Question,
Yes, please.
is it possible to, if you are enrolled in Medicare Advantage plan,
Yeah.
and during the enrollment period, if you want to go to the traditional Medicare, and buy the Medigap insurance. Is it possible to do that without underwriting process?
Oh, that's a very good question, and that's a very complex question also. When you go from Medicare Advantage plan to a Medicare, traditional Medicare with a Medicare Supplemental plan, unless you are in that first year, 7-month period, everything is subjected to underwriting. And based on that, depending upon your existing medical conditions, the insurance company may have some restrictions, or they may not approve it. Sudhir, you can expand on this one also.
Right. Dr. Yogesh, how are you, sir?
Doing well, thank you.
Yes, I'm glad you joined. And yeah, essentially from Part B date, it allows you 6 months without any underwriting.
So I guess if I understand it correctly, if money is not an object, then traditional Medicare with Medigap is the best option.
Right. That gives you, like in a driver's seat. You don't have to follow the network. You don't have to have a referral. You don't have any service area restriction, and in most cases, you don't have any kind of prior authorization that you need to wait for.
Thank you so much.
That's a very important question, and we were asked in every seminars we have given, and that is something we all need to know, because sometimes people think they can switch from Advantage plan back to Medicare, but then we may be in for a surprise with the supplemental plans. Okay, any other questions? You have a question? I think I heard somebody talking.
May I ask one more?
Yes, sir. Yes, sir. Go ahead, please.
Okay. If you get into Plan F,
Yes.
Will I be under the discretion of the insurance company whether I can stay in F, or they can move me out?
Yeah, that's sort of a administrative and legal question. Sudhir can answer that one.
Yeah, well, no, once you are in F plan, however the medical condition may be, they cannot kick you out. Only way they can stop it is if the premium is not paid. But other than that, there is no way they can kick you out. And the second thing can happen is a particular company simply withdraws their services from that given area, geographic area. In that case, you have a guarantee issue to another company for the same plan.
Okay, got it.
Yeah, that's a very important point, because a lot of times insurance companies drop out, and there's no way to say, you may be on it for 3 years, and all of a sudden they say, oh, we're not covering Houston or something. Then we'll be stranded.
That's known as nuclear option.
Yeah. Thank you. That's a good question. Anybody else has any other questions?
I guess in technical term, that is known as nuclear option.
No, this everything there's the cost. Okay, with that, ladies and gentlemen, we want to thank you so much for joining this a very important topic on Medicare Advantage Plan prescription drugs, and we are going to be processing this videotape which we are recording, and we will put it on Health Live 360 website, and Sudhir will send you a link to all of you, and we will see you in the next presentation. It's been a pleasure talking to all of you and sharing our information about Medicare and Medicare Advantage plans. Thank you so much.
Thank you all again, and we want to request, if you want a link, then please do request by email, because I won't know exactly who has joined, etc.
Okay.
And here is the link, insure at healthlife360.com, and this is something which you can just write it down and send an email, and then we will certainly get you the link.
Well, thank you.
With that, we're going to end the presentation. Thank you so much. We'll see you.
Enjoy the rest of the day. It is now bright and sunny.
Okay.
Thank you.
Thanks. Bye.
All right. We'll see you. Thank you so much.